Have you ever sat in a doctor's office describing how you feel and just wondered what's actually going on in their head? It's not just them ticking off boxes. No, it's more like a high-stakes detective story. And you're giving them the first and maybe the most important clues. So today, we're going to pull back that curtain and see exactly how they solve these medical mysteries.
Right. So how do they get from "I just feel off" to a specific diagnosis? Well, it's a super methodical process, almost like an investigation. And this investigation has two key parts, two different kinds of evidence that have to fit together perfectly, like two halves of a puzzle.
So here are those two halves. The whole process really boils down to this. On one side, you've got the subjective. That's your part. It's your story, what you're feeling, the words you use to describe it. Then on the other side, there's the objective. This is the hard evidence, the data the doctor gathers themselves. And we're going to start where every single medical mystery begins, with your story.
And really, it's that simple. It all starts with just listening. Forget the stethoscopes, the fancy machines, the lab tests, just for a second. The most powerful tool a doctor has, right at the start, is that conversation. This is where you, the patient, get to tell your side of the story.
Okay, now check this out because this number is honestly kind of mind-blowing. Studies have shown that a doctor can get the diagnosis right somewhere between 50 and 70% of the time just from listening to the patient's story. That's it, just the conversation. I mean, think about that for a second. Before a single physical exam, before any blood is drawn, the case is already more than halfway solved. It just goes to show the most important information in that room, it's coming from you.
And, this isn't just some casual chit-chat. It's a really structured process. It even has a fancy name, anamnesis, which is basically just the patient's complete medical history. The doctor is playing detective here, digging into everything, your complaints, the timeline of how this all started, and even your life history, all to find clues and connections you might not even see. And a lot of times, the whole thing kicks off with one simple, super powerful question. What ails you most? You might come in with a whole list of things that are wrong, right? But this question helps the doctor cut through all that and zero in on the main reason you're there. It's all about finding the signal in the noise.
But a great detective doesn't just sit back and listen, right? They ask questions, they probe. A doctor will actively look for other symptoms, things you might have forgotten or didn't think were important. They have this mental checklist, and they'll go through different body systems asking really specific questions. Hey, any trouble breathing? What about heart palpitations? Trying to uncover every last little clue.
What they're doing here is building a complete timeline of the illness. It's called anamnesis morbi, which is just a fancy way of saying the history of the disease. The doctor is basically writing the biography of your illness. They'll ask things like, okay, when did that chest pain first start? What were you doing? And then, how did things change over time? What tests have you had? Did that medication they gave you actually work? Every answer is like a new chapter in the story.
All right, so the story's been told, the timeline is laid out. Now the investigation shifts gears. We're moving from listening to seeing, touching and hearing. This is the second half of the puzzle, gathering the hard physical evidence in the objective exam.
And this is where the classic doctor's toolkit comes in. There are 4 basic techniques. First, inspection. That's just looking really carefully. Then, palpation. That's using touch to feel for anything unusual. Third is percussion, which is that tapping thing they do to hear the sounds your body makes. And last, auscultation, which is listening, usually with a stethoscope. These 4 things are like the bedrock of a physical exam.
Now, here's the really cool part. This isn't a totally separate step. The doctor is using all this physical evidence to test the ideas, the hypotheses that they started forming while you were telling your story. So, does the evidence line up with what you said? Does it confirm what they were thinking? Or does it introduce a crazy plot twist that sends the investigation in a whole new direction? To give you a real sense of how detailed this can get, let's just zoom in on one tiny piece of the objective exam, checking a patient's consciousness. It sounds simple, right? But it is absolutely critical, especially in an emergency. And it's a perfect window into just how methodical this whole process is.
So when we talk about consciousness in a hospital, we're not getting into some deep philosophical debate. Clinically, it's something very specific and measurable. It's the functional state of the brain. Can you be aware of what's going on? Can you react to your surroundings? Basically, are you with it? And if that's impaired, well, that's a huge red flag for a doctor.
And here's something you might not know. Losing consciousness isn't just an on or off switch. It's more like a spectrum, a sliding scale. Doctors have these very precise stages for it. It starts with something called obtundation, which is kind of like being stunned.
Then it can progress to sopor or stupor, and finally all the way to a coma, and each step down that ladder has very clear signs.
So let's look at what that actually means. If someone's in a state of obtundation, they're super drowsy, slow to respond, but you can still talk to them and get a response. Now, if they slip into sopor, they're unconscious. You can't talk to them. But, and this is key, if you apply a painful stimulus, they might have a coordinated defensive reaction, like trying to push your hand away. But in a full-on coma, even that is gone. There's no coordinated response to pain. It's that systematic checking of these very specific reactions that tells a doctor exactly how bad things are.
So, the doctor has your story, all the subjective clues, and they have the physical evidence, the objective clues. Now comes the final crucial part, putting all those puzzle pieces together.
And really, this is the main takeaway from all of this. A truly great diagnosis, it's not just about the MRI scan, and it's not just about what you said. The magic happens when you combine the two. It's that perfect blend of the patient's story and the doctor's hard evidence. It's when your words are confirmed or challenged by what the doctor can actually see and measure.
So it all leaves us with this one big question, doesn't it? Is medicine an art of listening, or is it a science of seeing? And I think what we've seen today is that the answer has to be yes, it's both. The very best doctors are part artist and part scientist, part empathetic listener and part hard-nosed investigator. They have to be to solve the most important mystery there is.